I'd like to start off today just by sharing a few words to remember and honor those who have lost their lives or been injured on this day of mourning. The flags at the legislature have been lowered today to honor the annual National Day of Mourning for persons killed or injured in the workplace. And the purpose of this day of mourning is twofold. First is to remember and honor those lives lost or injured, and secondly, to renew our commitment to making sure that we're improving health and safety. And on that front, I would like to again say a thank you to Manitoba's frontline workers who've shown us all such dedication in protecting us and in fighting COVID-19 every single day. I want to thank all our critical workers. They've been working exceptionally hard these last couple of months in very exceptional and stressful circumstances. And so on behalf of all Manitobans, I say thank you to you. I also wanted to give you a quick update on our, speaking of stress, our online mental health program. It's the first of its kind, and I understand that over 1,400 individuals have signed up now and are receiving counseling services. I also want to remind Manitobans who are feeling that they may need some help in this respect that this service is available to them free of charge for anyone 16 or over. If they're feeling worried or stressed and they have anxiety issues about COVID-19 or other related issues, obviously they have the chance now to receive care and counseling. The challenges you're facing are real. The pressures of caring for loved ones have never been greater. The uncertainty of what life looks like past COVID can feel overwhelming, but there is hope. Supports are waiting for you now, so sign up at manitoba.ca/COVID-19 and know that we're thinking of you and this service is there for you. Our number one priority during this unprecedented global pandemic has been keeping you and your loved ones safe, and that's why over a month ago we declared a province-wide state of emergency. And this was done to enable us to act quickly to respond to the needs of our front line and to protect the health and safety of all Manitobans. According to information that we've been given by the federal government from their Privy Council office, Manitoba in 10 different categories of involvement in supporting our citizens has been a leader in the country, and our programs have been, according to their data, among the most generous overall. We have also taken significant economic measures to respond to the challenges being faced, not exclusively by, but certainly by, a lot of our small businesses across the province. And we have done this while maintaining low case numbers, something we want to make sure we continue to do. I'm not running any victory lap here today. I want to be sure that Manitobans understand the challenges are going to remain and the fundamentals have to be followed for us to keep our case numbers low. The risk of COVID-19 remains. It is significant and it should not be minimized. You have the opportunity to save lives. You have the opportunity to protect yourself. And you have the opportunity to make sure you protect all those you love and those around you you may not even know. So please continue to do that. The necessary social distancing and other protocols that we put in place are working, and they're working thanks to Manitobans. So through good planning and good behaviors, Manitobans have been able to get ahead of the COVID-19 curves, and we flattened that curve. But we want to stay ahead of this virus, and we do not want to start chasing it again. And so that means that Manitobans must continue to be vigilant, because there is the potential, even with the curve beginning to flatten, that it can rise again, and we don't want to see that happen. Our guard must continue to be up, so must our spirits, so must our hopes. People who are bearing the brunt of this pandemic in this province right now are our seniors, our frontline people, our frontline small businesses, and we have been at the forefront of supporting all these groups through our social services and our small business supports. And I thank Manitobans for coming together in support of all those on the front lines and in support of our seniors in particular, who are the most vulnerable in our population. Because of the positive actions of Manitobans, we're thoughtfully and carefully beginning the long process of reopening our communities and restarting our economy. We look forward to beginning to lessen restrictions safely with the health and safety of Manitobans always at the forefront of our concerns through effective physical distancing protocols and guidelines. A critical element of our flattening efforts so far, and what's contributed to Manitoba's success, is our high levels of testing, of tracking, and of self-isolation practices. It's necessary we continue to increase our testing so we can ensure the health and well-being of Manitobans through effective monitoring of COVID as we look towards a strategy of restarting our economy. Un élément essentiel de nos efforts de aplatissement jusqu'à présent est ce qui a contribué au succès du Manitoba. Ce sont nos niveaux élevés de tests, de suivi et d'isolement. Il est nécessaire que nous continuions d'augmenter nos tests afin de pouvoir assurer la santé et le bien-être des Manitobans. Une surveillance efficace de COVID est très importante alors que nous envisageons une stratégie de redémarrage de notre économie. So today, I'm very pleased to announce that we will be tripling our testing capacity over the next few months with increased testing alongside CADM Provincial Lab at Dynacare. And secondly, we are expanding our testing criteria to any Manitobans who exhibit symptoms of COVID-19, even mild symptoms, including cough, runny nose, sore throat, fever, would allow you to be tested to better determine the spread of the virus in Manitoba. Staying the course while increasing our testing capacity is critical as we work towards safely reopening our economy. And we are going to keep the COVID curve flat, and as we do, we will ensure that all of us and our loved ones have a healthy Manitoba today and for many generations to come as well. So to all Manitobans who are doing the right thing to protect themselves and others, I say thank you. Keep doing what you're doing. Stay positive, encourage one another, be patient. I know that patience is required in these trying times, but help each other. We will be back. Together we'll beat this thing. Any questions, I'm glad to take them.
Thank you, Mr. Premier. A reminder to our reporters online, you will have one preliminary question and one follow-up. Up first, from CBC Manitoba, Bart.
Mr. Premier, Bart Cubicer, CBC. What do you estimate the cost per test will be, and how much will this cost Manitoba to get up to 3,000 tests a day ongoing, both in terms of onset and in terms of ongoing costs?
Be less than $10 million, Bartley, and I would emphasize that there's a tremendous cost in not expanding our testing criteria. And I think all of Manitobans understand that the fears that are out there right now, and the news coverage is of course informative, but it does in some ways add to those fears. It can't be ignored. And part of those fears have to be displaced, I think, by making sure that we're confident that when we reopen our economy, when we go into a store, for example, that the staff there isn't carrying COVID, or we won't go into the store in the first place. So as we reopen our economy, and I give you this as one example, it's important that the people who work in the store are confident that they don't have COVID, that they're not giving it to someone else. And it's important also, I think, for Manitobans to know that that's the case, so they can be confident when they do their shopping or when they are, moving around again in the city of Winnipeg or around the province.
Thank you for that, Mr. Premier. In the event that Manitobans don't take advantage of the testing capacity, much the same way they are not yet, they weren't taking advantage last week, will the province use the excess capacity to randomly select some asymptomatic people?
It's an interesting question, Bartley, and it's one that, in terms of other jurisdictions, some other jurisdictions, I understand Iceland is one that was brought to my attention, that have expanded their testing capacity to allow for additional research to be done. it's a question that's under discussion. But at this point, I just reemphasize that what we're looking to do by broadening the intake here, at least in its early days, is focused really on giving confidence to Manitobans that they can determine more quickly with the doubling of testing over the next short time, and the tripling by the end of summer. That's what we're shooting for, beyond what we have now. CADM Lab is up to full capacity. Dynacare's addition will mean that we will have much more ability to test more broadly and give Manitobans that confidence they need to have that they're not carrying the disease, that when they move around, when they shop, they're able to do so safely.
From the Canadian Press, Steve.
Steve Lambert from the Canadian Press. Mr. Pallister, I'm trying to get a sense of the timeline. By the time everything's up and running, you say before the end of summer, that will be the tripling. Does that require the new lab to be built first, and are you confident that a new lab can be built before the end of summer?
We're assured that that'll be the case. I should mention that Dynacare is doing testing now. This contract means they'll be ramping up the amount of testing in the foreseeable future. The lab location here, as part of the agreement that we have with Dynacare, assures us that in the longer term, again, I keep saying this should be treated more as a marathon than a sprint, Steve, so I'll say again that having that additional testing capacity is a really important advantage for us longer term as well, not just for COVID, but for other testing that Dynacare has had experience in doing for Manitobans for some time.
And is the province taking any steps to perhaps speed up the turnaround time in terms of getting some of the tests in rural and northern areas to the lab on a quicker basis?
Yeah, that's obviously a concern as well. It isn't just COVID here in the city, though the majority of cases, of course, are in Winnipeg, but it is the reality that people around the province, rural and northern areas, are going to need additional testing. And so the concern about turnaround time is in part being addressed by the availability of greater testing capacity. Obviously, fewer tests can be turned around more rapidly. We're going to need to have more testing done. And so we believe with this agreement with Dynacare on top of the CADM Lab and that doubling and then tripling later on in the summer of capacity, we're addressing both issues.
From CTV Winnipeg, Jeff.
Well, Mr. Premier, with your reopening plan coming, will restrictions on hospital visits be loosened at that time? Will that be part of that plan? Because people are asking when can they go visit loved ones in the hospital.
Yeah, all of us are concerned, obviously, that these restrictions can come down, but we're also concerned that they can be reduced safely. And so what we'll talk about tomorrow is our plan for how to achieve both those goals. And clearly today's announcement about additional testing is a key aspect of that, isn't it? Because reducing restrictions on Manitobans' ability to move is one thing, but giving them the confidence that they can move safely is the other. And so this testing enhancement is going to be a big part, I think, of giving Manitobans the confidence they deserve to have and will want to have going forward.
And my second question, with the province limiting the amount of prescriptions to 1 month's supply, is the province considering covering the cost of extra dispensing fees like Nova Scotia has done?
Yeah, no, we're obviously concerned about that. It's been an issue. It's been in particular of concern to me that our seniors are put in a position of having to absorb some of those additional costs. And so it's an issue that all the provinces have talked about. I'm told by my friend Cameron Friesen, our health minister, that the health ministers have this issue under discussion right now. So we'll look forward to further announcements on that. We know, and I'm very concerned, as I guess I've demonstrated maybe too much in the past about our seniors. But I do think that making sure that we have this additional testing I'm talking about today is going to serve our seniors very, very well as well, because they are the group that is, clearly in some instances the most fearful and most concerned about COVID, and they're the group that will benefit by not only with shopping at safe stores, but by also being able to get tested if they want to be tested and need to be tested for COVID. So I think we're addressing those concerns in a real way, and this is a positive announcement today.
From City News, Jonas.
Good morning, Mr. Premier. Just as far as we move through the week, you mentioned when you were speaking with Jeff earlier that tomorrow we may see some maybe measures announced on loosening. Are we expecting anything concrete or just kind of a template this week?
Yeah, I think you've all followed, if you haven't reported yourselves, you've all followed the, if I could say it, I guess the reaction to the announcements made in Ontario and Quebec yesterday. And there has been some criticism, I think, that there wasn't enough meat on the bones. And I think what we're trying to do here in Manitoba is strike a Manitoba plan that gives people some greater confidence that we're moving forward, while recognizing that we're staying focused on the safety and protection of all of us. That balancing act is not unique to us. It's a concern in every other jurisdiction. I'm a little sympathetic to the premiers of Ontario and Quebec in respect of the fact that they have had so many more cases, so many more deaths, so much more personal impact felt at every level, that I think we need to give them the benefit of the doubt on this issue. I think the premiers of those provinces and other provinces are doing a very good job of balancing these concerns and making sure that safety is what they're after is, I think, pretty evident in the plans that were announced yesterday by both provinces.
And as we do move towards reopening portions of the economy, Mr. Pallister, when you look at us progressing, is there one area that you're most concerned about that could lead to maybe a jump in case count or maybe some community transmission that we're not expecting? Yeah,
of course there is. I mean, I'm a sports fan, and I like a concert once in a while. I think all of us might like to enjoy those things, and I think the likelihood of that happening in the distant future is a lot less than for many other things. I think the reality is a big congregation of a lot of people is a danger to everybody there and a danger to all of us. So, those are things that are very likely going to be at the at the back of the pack when it comes to reopening.
From the Winnipeg Free Press, Carol.
Good morning, Premier. It's Carol Sanders at the Free Press. So now that the plan for reopening Manitoba's economy is expected soon, why is there no plan for the House to resume sitting?
Well, because that plan, before it's announced, has to be agreed upon by all parties. We have a desire to get back. I've made that very clear. But it's a negotiation, Carol, between House leaders, and that's underway. Okay.
But you have the power, you have the authority, I understand, to call back the House. Why not do that, just to show that you're accountable to Manitobans and to defend your government's plan for responding to the pandemic?
Well, like it or not, Carol, I don't do things for show. I'm about results, and my concern here is that I have no desire to disrespect the House leaders of the Liberal Party or the NDP, for that matter. And so I won't be dictating to them, despite a desire to do so. I'm not going to do that. The House leaders have to negotiate a return. I can share with you that I'd like to see us make sure that we do something on a regular basis over the next few weeks to demonstrate that this place is still at work. It is at work in respect to the government side, but I am absolutely cognizant of the need for the opposition to do its role. I was an opposition leader after all, and in opposition federally and provincially for a long time. So what I would like to see is a reopening of the House. That's what we're trying to negotiate. That's what I expect will happen in the next few days, but it's always subject, in my case, it will be subject to the House leaders agreeing.
From Global, Brittany.
Good morning, Mr. Premier. When we spoke last week, you said Manitoba was going to lead the pack when it came to reopening the economy. We've seen those plans from some provinces. We're hearing now that we're expecting to see ours tomorrow. What goes into putting together a reopening plan for something like this, and why does it take so long?
Well, it takes as long as it takes to get it right, I suppose, Brittany. What we want to do is be the first to have our economy reemerge. That's what I'm talking about, not the first to table a plan, the first to have our economy back up and functioning. That's what I'm about. I'm about results. But I'm also about results in protecting public safety. So that's what we've stayed focused on from the start. We're going to stay focused on that. And we've had tremendous cooperation and support from people in the small business sector and in the public sector, working with us to come up with ideas, means, mechanisms, protocols, which we've adopted, which are working to keep COVID flat. So I'm proud of the people that have been part of our planning, inside the public service, outside the public service, in the private sector. It's led to, for example, a limited reopening of our garden centres. That's just one example. But we'll talk about more aspects of our economy tomorrow and about how they may proceed to reopen in the future as well, because we all want to get back to that, but we all want to do it safely.
And Mr. Premier, there's been allegations of a retirement party at a fire hall with upwards of 30 people attending, hugs being handed out. If these allegations are true, what kind of message does this send to Manitobans about that need for social distancing that is, from all aspects, we've been told is so crucial?
Yeah, well, it obviously sends a horrible message. I mean, we have to follow the fundamentals. The fundamentals are to maintain social distancing practices. If we do that, then we can reopen our economy. If we don't do that, then our economy is going to stay closed down or partially closed down for a longer period. And that's bad for all of us. So it sends a bad message. There's no doubt about that. Look, there are families all over this province that are postponing weddings, christenings, postponing funerals to do the right thing. Hard thing, but the right thing. And I'd ask every Manitoban to subscribe to that. Retirement party or not, you can have that retirement party a little later and maybe safely. But right now is not the time to do that kind of thing. So let's try to all be on the same song sheet here. And if we can do that effectively, then we're going to move our province forward, not backward.
From the Brandon Sun, Drew.
Thank you. It's Drew May from the Brandon Sun here. Mr. Premier, in terms of the announcement today and expanding testing so much, does the province have any idea of what that might do to the number of active cases and how many are actually found?
Well, I'm not a scientist. I guess I'll just venture in on an area that Dr. Roussin can probably comment on, no doubt, with greater authority. I would say that increasing the frequency of testing will increase the number of COVID cases found, and I think we should be ready for that. I would defend the way we have run the testing in Manitoba up till now. We started by focusing on likely cases and on cohorts where there was a real possibility of contracting the disease, whether it was frontline workers or people who were demonstrating symptoms. Then we broadened it out to include the families of frontline workers and and so on. And we did this recognizing, like all provinces, like all jurisdictions, we had limited capacity and we wanted to focus on the most vulnerable people first. Now we've upgraded our testing and have had a number of people tested, obviously, thousands of people tested. So now we're able to expand our testing more broadly to the general population. As we do that, I expect the number of cases to be found to go up somewhat, but I would also say that the confidence that we'll have in our ability to be protecting each other's security on our own will go up as well. And so there's a good news, bad news scenario here. I would say more good news than bad news.
And if the cases do go up dramatically, would you foresee the plan to reopen the economy could be pushed back or modified?
Well, yeah, exactly. Drew, what you're pointing out there is the danger of a second wave. I've spoken about this to you before and to Manitobans before. There's a real danger if we depart from following the social distancing and hand washing and the other practices that we have been using to protect each other. If we depart from that and we forget about those fundamentals, that number will come back up. And that's entirely in Manitoba's hands, literally and figuratively. So we need to make sure that doesn't happen. I think everyone I've talked to in the small business sector has said the same thing. We have to reopen carefully because we want to sustain our recovery. We don't want to have another backslide. And so that is clearly part of what's behind today's announcement in the expanding of testing to make sure that we can sustain our number of tests and grow the confidence of Manitobans in their own health and safety as we move forward.
From CJOB, Diana.
Good morning, Mr. Premier. Diana from 680 CJOB. I'm wondering, how is testing going to work? Are we going to need to open up more testing centres as we expand the capacity for this, now that more people can go and get tested? And if we're now testing all symptomatic Manitobans, why do they need to call Healthlinks first if they're obviously not verifying that they're in a certain population?
Well, again, obviously we don't want people just willy-nilly going for a test when they're not demonstrating symptoms. That would be a waste of their time, because then a week later, if they got the sniffles, they'd be going back and getting tested again. There's no point in doing that. You can call, and we have numerous drive-through centers, numerous testing centers we've established. Their capacity to do more initial testing is expanded now as a consequence in part of the reduced demand from the group that we had already been testing, right? So there's a capacity for more tests to be done, and today for more tests to be evaluated more quickly. And so by expanding that testing, we'll be able to make better use of the facilities that we're contracting with, in addition to CADM Lab today with Dynacare, and make sure that we're able to give that result back to people who may have concerns, I would think more readily than would be the case under the previous limited model.
And as a follow-up, just as far as possible layoffs, are we going to see any layoffs of public service employees? Obviously, the city of Winnipeg laid off hundreds of workers, and your government certainly was looking at the reduced work week for certain employees to prevent layoffs. But where do we stand right now on those discussions, and kind of just what's the status of that?
Yeah, well, that's been widely misrepresented by some, unfortunately, and fear has been the result. We had announced earlier that we intended to use, whenever possible, shared work practices so we could avoid layoffs. We prefer not to do layoffs. I think that there have already been some agreements made with labor providers to go with shared work weeks with some of the government agencies, and I expect others to follow. The fact of the matter is that we have less demand in many areas of the public service. We have over half our government buildings that are either fully or partially closed to the public, so clearly there's not the same demand for reception services as there was before COVID. We have empty buildings. We don't need to clean them. We don't need everybody to take a broom and pretend they're cleaning a building. We like to pay people who do real work in our civil service. And right now, there's a lower need in some areas of the civil service. So we'll outline our detailed plan across government. I don't expect it to be anywhere near 10% impact. The fact of the matter is it'll be less than that, and it'll vary by department. But the whole purpose of this is, of course, to make sure that we are providing some savings and some resources so we can beef up our investments in the front line. And that's where the protections are the priority during this COVID pandemic.
From the Winnipeg Sun, Scott.
Hello, Premier. Scott Billett from Big Sun. Question about, so we've talked about testing sites and all that, but Healthlinks, obviously it's been upgraded, more lines and stuff, but is there enough in place so that Healthlinks isn't overrun over the next, week or so of calls coming in?
It's a good question, Scott. I think so. We'll know by the response of Manitobans. There's always a danger that in the early days there's a rapid increase, and that might create some call waiting times. I just share with you on the while you raised this about call waiting, our economic support center that we announced last week, and we've got it up and running now, doing calls. This is to assist Manitoba small businesses, individuals who want information on support programs, whether they're our GAP program or the federal program. They're able to call and get that help. And I should update you that our call waiting on our inbound calls, which are significant, is less than 1 minute, which is not a reflection of small demand. I'd also say we've made contact with over 36,000 businesses, nonprofits, and charities to assist, and we're assisting directly many of those in the application process for the federal programs and the information process for ours, and ours should be up in the next few days for our GAP funding. So we just announced this last week. We've already got it up and running. We've already saved Manitoba small businesses hundreds of thousands of hours because the federal waits are long. And that's not a criticism. It's just a reality. They're hours long. So by going to our call center, getting your information, you'll save yourselves a lot of time. And that's what we're trying to do because time is money for all of us, and for small businesses, that is absolutely true.
And for my follow-up, been getting reports in about the ICBT program that it kind of scratches the surface for people. There's not a lot of one-on-one interaction. It's mostly web-based, and people are just reading and submitting something and getting the okay, and then going on to the next module. Was there supposed to be more one-on-one interaction for people on that, or is this just kind of I guess just kind of a baseline kind of mental health program?
First criticism I've heard of it. I'm interested in knowing more. If Manitobans are concerned they're not getting the therapy or the support, the strengthening that they need from the program, I want to hear about that. We've heard lots of favorable comments, by the way, but this is the first criticism I've heard.
From CBC Radio-Canada, Patrick.
Bonjour, Monsieur Pallister. Patrick Foucault, Radio-Canada. I understand, so you'll introduce details on your plan to ease some restrictions tomorrow, and that you're probably limited in what you can tell us today. But what can you tell us on inter-provincial and international traveling restrictions? Is that going to be one of the first restrictions we'll see, or will that be much later?
Vous avez raison pour votre observation. Demain, nous sommes présentés votre plan pour Manitoba et une inclusion certainement la mobilité et la nécessité pour restricter certain degré la mobilité des voyageurs. There'll be many other aspects of the plan that we'll release tomorrow. I would also say, and I would hope in the common sense would dictate, that this is a multifaceted, very complex exercise. Some of it is ongoing because we are doing consultation, for example, in respect of the way in which we are delivering services, and right now in government restricting the ability of people to get to their office, to work there, to do the things they would like to do. And so we will be developing strategies not only for private sector, but also in more detail as we move forward for the public sector, so that as we move out of this pandemic, we do a better job. We learn from the challenges that we've been facing together here in Manitoba, and by studying the impacts and the experimentation and innovation of others around the country and around the world, I believe we can move our public service forward in a way that can strengthen the quality of work and the ability of those who work within it to do an even better job than they do today.
Merci pour le commentaire en français. And my next question, so earlier this month you've renewed your call and said that you had the other Premier support for the Provincial Borrowing Initiative. I wanted to follow up with you on this because you then said that you were waiting for a response from Prime Minister Trudeau. Did you get a response from Justin Trudeau? Where are we in that process?
Where we are is that we continue to get endorsements and support. We just got the endorsement of the National Canadian Federation of Independent Business in support of our plan. We have a research project underway with an institute, a think tank called CD Howe, that is investigating this. The Globe and Mail newspaper editorialized that this was an option that could be explored. We've seen some response from the federal government, and I thank them for that, by encouraging the Bank of Canada to enter into the accepting of provincial debt in its lending practices. That has still kept us about a full percentage point higher than the federal government. So I would again say, and the premiers are unanimous on this, this is a time when we can either strengthen our healthcare system by reducing our interest costs for COVID borrowing, or we can strengthen banks' financial balance sheets. I would prefer to see us strengthen the ability of provinces to deliver healthcare. The federal government doesn't see its way clear to doing that indirectly by assisting us in the borrowing of hundreds of billions of additional dollars to respond to the COVID pandemic. I would hope that they would, at long last, respond by strengthening their commitment to funding health care in this country. I just say thank you to everyone. Keep up the good work and stay positive.